You said yoga is not like a modern medicine, but it's totally different concept, the approach, everything is then. But today we are badly in need of evidence. At any cost we have to provide evidence because we are in a world where our practice is based on evidence. So we are forced to do trials, show results, and we are in such a condition. What is your advice based on your experience? How do we carry around?
This is a very philosophical question actually, because when you look at many evidence-based trials and drugs and systems that have been established based on this, like Dr. Gangadhar was saying in the morning, shelf value of that is only about 30 to 40 years, and sometimes this is also coming down because there is some kind of research that says, oh, this works, and we accept it and we start, then there comes some side effects. And then there is some research done on the side effect, then that is cut, then there is something new that is coming. We are only replacing one with another. So there is another method, which is that time testedness is another aspect. If some technique is not working, will it sustain so many years? Then there is a more philosophical point of view that I would like to say, and this is where the most fundamental thing about yoga comes in is, again I feel in our society we have come to a state where we have become a little bit fanatic, where we say that there is only one way of establishing what is valid, that is evidence based. If there is no evidence, it does not mean, if there is no evidence, it means it is not valid. This is how we have come now. But lack of evidence is not evidence that something is lacking in the method. You understand? It just means maybe your model is not right, or maybe there is more than one way of establishing a reality. That is why in yoga philosophy, they say there are, in the morning Dr. Nayak was speaking, he used a word called pramana. Pramana is a way of establishing a fact. And in yoga they say there are three ways of establishing a fact. Pratyaksha, Anumana, Agama. Pratyaksha is your own experience through the senses. I see you because my senses is telling me that you are there. So I don't need another evidence, I can see through the senses. Anumanam is inference, what we are doing in scientific experiments. We make a test on a small part and we expand that to a reality. Maybe you are given feedback forms. You say the feedback is good, feedback is bad, you take a, please.
I have a few points to make. Firstly, that your talk was, I missed part of it because I had to go out, wonderful and full of energy and wisdom. And it was very useful talk, first thing. But few points, for example, you said the yoga is trust, modern medicine is not trust. Trust is there. I know trust, it depends on me. I am also getting treatment since my childhood. We had a lot of trust then, now it is less. But trust is there. And not only that, trust does have effect on the patient. If you trust your doctor with saying one thing, then in cancer patient you cannot do anything. It's not so, because see, we have cancer which is incurable from medical point of view, and then you can be very useful as palliative care.
Yeah.
Isn't it? We also modern medicine.
No, that is what I was saying, sir.
Palliative, yeah.
Cancer, the illness of cancer cannot be taken away through yoga practices. We need some intervention like surgery or chemotherapy, etc. But after that, there can be palliative, there can be pacificatory treatments, which is possible through yoga.
And also what is raised, the prayer heals, it has been recorded by medical journals. Prayer heals, and where a physician also participates in mass prayer allowing patients is more effective. Healing about prayer has been proved by medical journals. It is there already.
Yeah.
Immunology, it has some effect, it seems.
Yeah.
That is why mantra is one of the most important tools.
Mantra is different. Prayer plus something else. Chanting is the energy there.
Yeah.
Another point, there is 3 pramana. There are Ashtapraman. There are Ashtapraman, 8 pramanas.
9, sir, actually.
Pratiksha, Anuman, and Agama,
Sattva, Pati, there are many of them.
Some 8
but
are there.
Yoga is accepting 3.
Why?
Pratyaksha, Anumana, Agamaha, Pramanani is the yogic sutra.
Yoga Sutra.
Other schools like Vedanta philosophy,
Eight.
Visishtadvaita, Buddhism, etc., they have other pramanas as well.
Yes.
But yoga is limiting itself to 3 of them.
And your Pratyaksha is the basis for others,
Yeah.
that's fine. And also what is measurable, how can we measure the love, how many milligrams, how many kilograms, how many microns, you cannot measure it. But you can express. If your mother, somebody loves you, you cannot
Yeah.
measure, you can feel it. You can feel from facial expression. And there will be physiological change, there will be change in the neurotransmitters, but at present we are not very sure about how to measure them. Changes will be there, physiological, psychological. That's right. Very good, very beautiful talk.
Thank you, sir.